we would like to start up very few information related to the clinical case studies. Now I welcome to entire Zoom class as well as the physical class. If the people who are really wanted to do some presentation on the clinical studies based on your clinical experience, and I welcome to all of you. So in this case, anybody who wanted to tell about your clinical experience related to some particular disease or illness or disorders or uneasiness, so which you have treated before by using some of the modalities which is related to the acupuncture or acupressure or the moxibustion or tuina or anything with the herbal medicine or with any kind of the mixopathy. Normally the mixopathy is not advisable, but still we wanted to use as the purely we have done or anything as integratedly has been done. So I think anybody on the physical class, please you just put a word, what is your clinical experiences which you were treated or you are treating or you will going to treat. Because in the research proposal we do have a lot of concept in future. We need to do some kind of through the ethical committee we wanted to do some kind of the novel research which need to be do the publication under the clinical trials or the randomized clinical trials or the specialization clinical trials, something you have done before or that information really would like to know about this. But in fact we would like to see another maximum 15 minutes. I will give the time to all of you. In 15 minutes, maybe 1 minute or 2 minutes or 3 minutes or 5 minutes, anybody wanted to tell some particular disease or illness or disorders. Since I keep talking, better I need to listen to you all what exactly you have been done. Since many people are practitioners, I know that, but what will be the outcome and prognosis? Then you are treating the what percentage of the results you are obtaining by the each individual patient, or overall what is the success rate in your clinical practice? Whether do you use as a single needle or the 2 needles or the 4 needles or the multiple needles or the clinical acupuncture or the classical acupuncture or the auricular you are using or the scalp you are using, anything connected to this. So is there anything like that which you have done already or you will going to do or you are doing the same? So please welcome to each one of you. Anybody wanted to tell, please, this is the open discussion. Is there? Open your mouth and then tell me. Before stepping into that, please tell your name and then I think you can start that. Yes, please. Anything.
Good morning, sir.
Yes, very good morning.
Karthik Janagram.
Wow, please welcome. Please welcome.
So, we am basically a self-learned acupuncturist.
Right.
I'm learning from you. But after basically some pulse analysis.
Yes.
So, pulse analysis after a few patients, my clinical rate has been pretty successful.
Oh, that's a great to hear. That's a great.
Hyperhidrosis, sweaty palms, sweaty legs.
Right. Very good.
Just one needle. SJ5 is really hyperhidrosis.
SJ5 you use it for the hyperhidrosis. Right.
And for I just for 1 or 2 seconds needle, that's it.
Right. Very good. Anything you wanted to add up further?
So the clinical results have been good for 6 to 7 months. No study for 6 to 7 months.
Right. So to know about the Karthik Janakiram, he is the person, he is the really something, is the unique person. In fact, despite of suffering himself and treating himself and treating to others, and successfully he has done many things, but that's what actually about the Janaki Raman's wife told me at the time of the admission. So being I don't want to tell, but still I'll tell for your to become the braveness of you people, since he is suffering for the PD problem, Parkinsonism disease. But despite of that, sorry to say, I don't want to disclose this, but still we need to encourage and we need to emphasize him that Despite of that, he has done already many research on the various fields, not only in terms of acupuncture, but we do require from your side, Karthik ji, you need to understand, since you are suffering partially some kind of the problem. For that, what I would like to suggest you, please you just do the analysis and do the research on the PD problem. Number one is to be known as a substantia nigra is the reason to cause the Parkinsonism disease, but try to find out the proper identification of that location, then how we should handle to treat to the tremors or some kind of the speech morbidity or other parameters, but how the coordination to be taken place from the brain to the peripheral nervous system. This is the task even I wanted to give you, because since you know the people can tell lot, but since you are suffering at the same time you can realize the internal feelings and then sign and symptoms, and based on that how you can handle and to treat yourself, and to how to identify what are the clinical studies has been proven by the globally by the PubMed or some other articles. You try to find out and then get the right answer. So hopefully you also will be the one person among this world that you have proven and treated for this successfully, because no treatment is available for the PD today, but still we need to do the best of the best. Thank you. Anything else you wanted to add up, anybody? Yes.
Usage of GB21 for shoulder.
Sir.
Welcome, Sinan. Yes.
This is Fasal from Dubai.
Just a second, I am taking the physical question. Just a minute, yeah.
So there was a shoulder pain. Use GB21
Huh.
and SI50. These 2 points stimulation I did. So it was a good relief. And then similarly, I treated same points for other 3 to 4 patients. So they got very good relief. Instant relief for them.
Very good. So here is the clinical studies is coming like the shoulder brachial syndrome, who got it the pain on the either right or left side, so treated by using the only 2 points, the instantly got some maximum recovery or relief. So number 1 point to be known as a GB21, the second point to be known as a SI15. So both the points are very close to each other. 1 point is upper trapezius muscle, second point to be known as a scalene muscles motor point. So therefore both the points are really good point. Once you penetrated and then do the small vibration touching to be taken place on that region, certainly patient will get the instant relief of that. Muscles gets the whatever there is a stagnation is there, spasm is there, spasm get releases. Yes. So I'll take up your question. Fazil sir, you just tell me.
Sir, you were saying about the PC meridian related or any other?
No, anything which you have done before.
Yeah, with PC meridian, I have many experience, sir.
Yes.
PC NAN and PC6, especially mind related, I mean stress or tension, headache, and all. I have so many experience. So whomever I use to any of the point, the result is above 90%.
You mean to say PC6?
Or PC9.
PC6 or the PC9. Very good. We will come to know that definitely before completing this meridian. So getting the great results by using the Nikuan and then Chung Chung. That is the P6 and then P9. These points are really great point to treat for the numerous diseases related to the mind constitution. You mean to say what indications you are telling? Emotional.
Yeah, emotional, either the tension related headache, stress. These are the main issues in recent days people are suffering.
Good. So only this P6 point would be really great point to treat for all the emotional related disorders. Really this is the benchmark information, and definitely this will going to be implemented each one of us. Next. Further any case studies? Yes, Savita.
In continuation with the same, I experimented with
Just a second, yeah.
including myself, I have got this Buddha strand which we are talking.
Yes.
LU9, X7 and P6. a lot of emotional stress can be reduced in that. It's a very powerful one. And within one reading itself, one setting itself, a lot of improvement can be seen. Depression can be reduced. Balance of emotional development and calming the shell is very important. So this is a powerful one.
Very good, very good.
C6 you can add like other points as well.
Yes. So here is the Savita ji is telling, who is doing the master second year, and she is highlighting that though if we add up along with the inner gate P6, that's called as a triangular Buddha. So H7 and then LU9 P6. These are the 3 points collectively should be useful to treat for all the emotional and psychological and also the psychosomatic related diseases, but instantly patient feel lot of changes. She too have the great experience and also treating for the others. Yes, I'll take up the other question. Thank you, Savita ji.
Sir,
Yes, please.
sir, good morning.
Very good
Sir,
morning.
I'm Saranya from Madurai.
Yes, tell me, Sharanya.
Sir, recently I have given a success for 2 patients, sir, for high creatine and low GFR.
Good. Okay.
They again, when they come, they have 2, sir. Creatine level is 2. After getting treatment within 20 to 25 days, now they are getting normal 1.2, sir.
It's amazing. Really very good, very good changes in them.
GFR rate also 46 only they had.
Okay.
Now it becomes 76, sir.
Wow, it's amazing. Really, it's amazing to know that, because these days the people are really suffering for the this renal system disorders. But in 25 days. But how many sittings did you do?
Weekly twice only, sir. Not only acupuncture, multi-treatment, especially moxibustion, ginger moxibustion I have used, and steam bath, and special diet schedule also I have given. Especially per day, only 0.3 to 5 grams only they have taken as all. Then high fiber. Likewise, I given a diet chart also. As per they have followed and they have given a successor.
Right. Do the follow for another 6 months.
Yes,
Don't leave them until, because knows if the 6 months the patient will be all right within the limits, then you have treated really very successfully, and in that way you keep doing, maintain further management, ask them to visit fortnightly or weekly once.
Yeah.
Let they continue for another 6 months in order to understand in the
Especially I
better
have
way.
used last time we have taken the class for renal system, no, sir. It was very useful to me. So K7, K10 and back shoe points also I have used acupuncture as well as motivation. It was really amazing, sir.
Very good information. But 76, you told me there is EGFR. So let that also go to the greater than 90. That would be until you get the 90. You just do it, but that will be really great information, and also you will going to be great successful treating this kind of the cases. You will get the hundreds of the diseases in this way. Definitely, these are great changes. So hopefully in this way, we also wanted to do like a back shoe, move friend, moxibustion as a integrated modalities is advisable in order to treat for the maximum recovery. Right. Anything else?
Sir, can I share my own experience? This is Shazad Begum from Bangalore.
Yes. Tell me, please. Tell me, madam.
Sir, I had my nephew as a guest from Kuwait for
Good.
just a few days. He was suffering from knee pain. He was not even able to walk properly.
Right.
What I did was, the first day I gave him good oil massage, Ayurvedic oils,
Yes.
and then I gave cupping theory for the first day.
Yes.
In the evening, I gave him hot water fermentation. In that itself, he got relief around 20 to 25%. And then the very next day, on the correspondence elbow points, I used L11 and H3 and needled him.
Good.
And by God's grace and Allah's blessings, 100% he had relief in that pain.
Really
Until
great.
now, he didn't get that pain again, sir.
That's amazing. That's amazing. How old he is? He or she?
He is around 40 years.
Good. 40 years old and treated successfully by using the oil massage. Did you do the dry cupping or wet cupping?
Dry cupping, sir.
Dry cupping with oil massage and dry cupping, and then is the contralateral side according to the image correspondence, and she treated by using the Li11, LU5 and other if possible P3 or
And I did
H3.
moxibustion also, sir.
Oh, moxibustion also done.
In and around knee.
In and around the knee, moxibustion also done, and the patient got successfully relief. But here is really I need to appreciate greater level, but in this way called as a OA, osteoarthritis of the knee. If that case also required to do this kind of the procedures, that also really good. Perhaps the 40 years is not much degeneration of the skeletal system not taken place. Mild to moderate was happened, but in that case you are treated successfully. That's a great thing. But in this way, please, madam, you also treat for the, because in this age OA, that means greater than 50-60 years old people, the millions of the people are suffering for the osteoarthritis of the knee, and do this kind of the clinical studies. That will be really good for the later future. Yes, I'll take up your question, please. Yes, please tell me your question.
Sir, I treated skin disease,
Uh-huh.
skin itching and red pimples are there in leg regions.
Yes,
First day I gave spleen 6 and 8 10, sir.
yes.
Little lesser. Next day I will give K7, K3 and K10, sir. It's gone, sir. Itching and all, it's full washout, sir.
So now got the dermatitis, or they related to the some kind of the itching or skin eruptions or pruritus or kind of the skin eruptions or skin conditions, treated by using the 3 points. First time she was treated, 1 point is spleen 6, the second point is spleen 8, the third point is spleen 10. These are the 3 points first treated, and then the next day or after 3 days.
No, sir.
Next day treated by using the K3 and then K7 and then K10. So these are the 3 points he treated next day, and the patient got successfully. There is
Itching is gone, sir.
no itching. Itching has gone. It's not eczema. It is kind of the pruritus. Some kind of the skin eruptions or some kind of the skin allergy happen. So that treated by using the spleen meridian and also kidney meridian. 3 plus 3, 6 points. She have recovered the maximum recovery to the itching related disorders. Good. Thank you. It's a very good information. Yes. Anything else?
One more, sir.
Yes, Mini James, you just come on. Yeah.
One more, sir. He got
Sir,
so
I had many
much
experience.
tired, sir.
Sorry?
Not only PCM points, but Masterton points also had many results. So whatever I do, by God's grace, I got soon result. Anxiety and mental related problem, I used to give Buddha Frankel. That also is very nice. But another one is mostly I do Masterton points, na sir. So for depression or anxiety and all, if I give you 66.0304, then that means what to say, mortgage related. Then after that, Lingu Dabai. Then DU20. This much, if I give, suddenly they got released from depression and all everything.
Very good. So now the points are coming to treat for the anxiety and depression. There are the 1 point is the DO20. Second protocol to be known as the Buddha's triangle, P6 and LU9 and H7. The third point is Li4 proximal and Li4 distal. There are the 2 points on the first metacarpal bones, and then first is 66.04 and 06, I believe, that is liver 3 and then stomach 43. That region, the points are really good point to treat for the numerous diseases related to the mind constitution,
Skin related problems,
skin
even
related.
cancer, everything I had results. But before coming to the TCM, much, then I used to do Nasatim Nasa. So every points are very magical. That only I can say. Even fear problems, fear to death. So I used to give H7. That also very good results, sir.
Very good. The people who have the suicidal symptoms also treated by activating the H7 point, which will be really helpful to treat for the all the mind related disorders. Really, it's amazing. Minnie James, you are doing successfully in your place. I know that in Kerala, and further Almighty should give the healing hands to each one of us. Right. Anything else you wanted
Can
to?
I add,
Yes,
can I
yes.
add something to James, Mini James' comment?
Yes, yes, please.
So, Master Term 1106 is very important point for all women-related issues.
1106 and 11024. These are the 2 points, 11.06 and 11.06 and 11.24. Both the points are really good point to treat for the all the gynecological disorders. Yes, please.
Yes, sir.
I am Sheja from Kerala.
Yes, yes,
I
please.
also treated PCOD 11 with 11.24 and 11.06. One patient came to me after 2 years. She has PCOD problem, and she has even done DNC.
Yes.
But didn't come periods. After I pricked that needle, 2 hours after she got periods.
Good, very good results. Using
Sir,
that.
I also treated myself for neck pain and back spinal
Pains,
cord pain.
yes.
7701, 7702, 7703. 3 needles I applied near my foot. Master tool.
Yes, this also really great point, 77.010203, which is located on the Achilles tendon. So where the points are located on this region, 1, 2, 3. 3.5 chun proximal to the sole of the foot, and then 2 chun proximal to that, again 2 chun proximal to this. So these are the points are really good point to treat for all the neck related disorders. In that way, that is really useful, because this also tendon, the people who have the tendon related disorders, where this the vertebrae exactly very close to that is which we call as a, where is the origin of the upper trapezius muscles and the scalene muscles. So there they will get some kind of the stiffness, because that become the tendon. So like that, treat through the tendon by using the tendon points itself. So therefore 77.123 points are really good point to treat for that head and neck related disorders, because you know that is 7.01 and 0203 that covers the 1 to C1 to C3, C3 to C5, C5 to T1. These are the cervical to thoracic region. It broad spectrum, it covers the entire area. So therefore that will be really useful. I think
Sir, one more, sir. Sir, one more request. I want to treat for shortness of breath. One of my friend is not able to breathe properly.
Right.
Which master tomb points can I use, sir?
Yes, why you wanted to use only that specific region, but however you can use the 1.5 chun distal to the Chiza, that is LU5. 1.5 chun distal to the LU5, you can use that point also, really good point. That also one of the master tung point. Further you wanted to use as a Tianfu and Xiao Hai. These are both the points are good. One is LU3 and then LU4. Both the points you can use it. Right. Anything?
Sir, only one more.
Yeah.
I'm Sunita.
from
Yes,
Kerala
yes,
because
yes.
my mother, she have severe incontinence. Every 1 hour she is passing urine. What I did, REN 3 and REN 6 deep moxa I did plus DU4. DU4 moxa plus K3 K7. After that she passed only one time in the night.
Wow, it's amazing, amazing, because the incontinence of the urination or the night time passing the urine is very great problem, especially in the geriatric people, and for them she treated by using the REN 3 REN 3 and then REN 6, and further is the Ming Men is the DU4 point using the moxibustion, along with that is the K3 and then K7. These points has been helped a lot to regulate the urine outflow, where the uterine contraction to be properly taken place rather than getting the floppy muscles of the uterine muscles. It gets sometimes is the process of the urination oftenly, but she targeted from the anterior region of the body and also the dorsal region of the body, and further she add up to the kidney points as well. So hopefully this is really amazing. So I think only one question I take up. This is the last question. Anyone wanted to present either here or Zoom? I'll take one question, then we'll proceed for our topic.
Bulky uterus and fibroid.
Bulky uterus and fibroid, yes.
What are the points will use?
I'll take up clinical studies, but I'll tell you later, yes. Anything?
Exercise,
It means
exercise
I have treated a problem, but when it happens, like it's only when it's acute.
Please come again.
I have treated many problems like cervical and the elbow.
Yes.
But when it good like what to say, I get proper result when it is acute. What's the reason? When there is acute pain, then it will be gone. But if it's mild, then it will be stay.
No, elbow pain, cervical pain, you are asking me what we should do.
Yeah. No, I have done cervical pain point C7. It was gone when it was severe acute. Then it was little mild, then it is not gone. First session only had it was cured
Right.
for acute. What's the reason? Only one point is needed, C7, but for severe only, this problem only.
Yes, some disturbance is there in your phone or where exactly, I'm not very sure. But however, for the cervical pain and then elbow pain, but perhaps the cervical pain is the reason to cause the elbow pain. But however, you just target the area called as a C5, C6, C7. C5, C6, C7. These are the three areas you cover where the origin of the musculocutaneous nerve is the reason to cause that pain, and that condition you treat on the cervical region. Further, you wanted to use as a distal points. Of course, LI11 you can use it. Then further there is a point is the SI6. SI6 you just activate and further ask them to move the neck region. Patient feel lot of changes. Right? So hopefully we will wind up now. Then we will proceed for the next topic.